Hello, my name is David Wenger. I'm a third-year medical student at the OSU College of Osteopathic Medicine. These are my co-authors, also from the OSU College of Osteopathic Medicine, as well as the OU College of Medicine. I'm here this afternoon to present our research entitled An Evaluation of Reporting Guidelines and Clinical Trial Registry Requirements Among Otolaryngology Journals. We decided to conduct this study as previous investigations have shown poor utilization of reporting guidelines as well as clinical trial registries among different surgical subspecialties. We thought that it would be an interesting idea to evaluate this in the field of otolaryngology. Our overall goals for this study were to evaluate the different editorial policies of the top 20 otolaryngology journals and determine their adherence to reporting guidelines as well as different clinical trial registries. We then aim to evaluate the RCTs published in these journals and determine their compliance to reporting guidelines, specifically the consort statement, which is a reporting guideline for randomized controlled trials, as well as their utilization of clinical trial registration. We then evaluated if journals requiring, recommending, or not requiring the reporting guidelines and clinical trial registration had any effect on their studies being published adhering to the different reporting guidelines and clinical trial registries. Our study is cross-sectional in design. We began by taking the top 20 otolaryngology journals according to their H5 index on Google Scholar. We then went in and evaluated each journal's instructions for authors page on their website to determine if they required, recommended, or did not require the most common reporting guidelines in different clinical trial registries. We then conducted a search on PubMed for RCTs published in these journals from June 8, 2017 to June 8, 2021. We individually analyzed each study to determine the presence of a consort diagram, which indicated adherence to reporting guidelines, as well as the presence of a clinical trial registry number, which would indicate adherence to clinical trial registration. We found that 9 of the 20 top journals did not require the use of a single reporting guideline, and that 9 of the 20 top journals did not require clinical trial registration prior to publication. From our search on PubMed, we ultimately included 667 RCTs. 199 of these were published in journals requiring the consort statement, and 41% of these did not contain a consort diagram indicating poor adherence. We also found that 235 RCTs were published in journals recommending the consort statement, and that 61% of these did not contain a consort diagram. After our statistical analysis, we found that RCTs published in journals requiring the consort statement were 2.3 times more likely to contain a consort diagram indicating higher adherence in the journals requiring. As far as clinical trial registration, we found that 433 or 65% of the total RCTs did not contain a clinical trial registration number. As far as our overall results of our study, we found subpar utilization of both the reporting guidelines as well as clinical trial registration. This is concerning as without prior registration to these guidelines as well as clinical trial registries, it allows for selective reporting of different outcomes and ultimately reporting bias. This is of concern as RCTs are one of the top forms of clinical evidence and ultimately go on to play a significant role in the formation of clinical practice guidelines and ultimately guide patient care in the field of otolaryngology. While this is concerning, it does appear to be a correctable problem at the journal level. We found that those journals requiring were much more likely to contain RCTs adhering to reporting guidelines and clinical trial registrations compared to those recommending. So a simple changing of the verbiage in the instructions for authors page appears to have a significant downstream effect and lead to the production of RCTs of higher methodological quality. We found that after a dive into the research, we found that the most common reasons for non-adherence reporting guidelines and clinical trial registries was lack of training on the utilization of these guidelines, a lack of understanding of the guidelines themselves, as well as a lack of encouragement to use the guidelines by the different journals. We found that the Equator Network is a perfect resource for the different journals to use. It contains all published reporting guidelines, as well as information on how to interpret these guidelines and how to adhere to these guidelines. We recommend that each journal begin requiring the different reporting guidelines, as well as publish a link to the Equator Network on their instructions for authors. And this will ultimately lead to production of higher methodological quality RCTs and ultimately benefit the field of otolaryngology as a whole. Here is my contact information and thank you for your time.